In Essential Task 7.5, we are going to identify 3 specific real-life applications of operant conditioning. I think this concept map works horizontally the best. It's simply 3 boxes left to right, as you see here. I will allow you to pause the video here, though, before continuing into the concept map. We'll start all the way on the left with a concept called learned helplessness. Learned helplessness occurs when an organism believes punishment is inescapable, and as a result, they stop trying, although success could be obtained. So here's the way this works. Let's say you've been in math class and you've failed math tests again and again and again, and you get to the point where you tell yourself, there's no point in even trying. There's no way I can avoid failing the next test. Well, technically speaking, there are probable ways, whether it's getting extra help, beginning in a study group, working a little bit harder, studying longer than you typically do. There are probably things that you could do that would improve your likelihood of passing that next math exam. But if you get to the point where you tell yourself, what's the point? Punishment is inescapable. You're exhibiting what's called learned helplessness. The classic way that this was studied was by a gentleman named Martin Seligman. We'll talk about him in another context later this year. But he essentially took dogs, brought them into the lab, and set up an invisible fence. If you're familiar with those invisible fences, they'll typically shock the dog once they pass the fence. It's designed to make sure that your dog doesn't wander off your property. Well, he set up one of those contraptions in the lab and made it so that half of the cage was electrified. You went over to that side, the dog would be shocked. And the dogs very quickly realized that when they went to that side of the cage, they would be shocked. Then Seligman turned off the machine, allowing the dogs to wander freely. But what's important here is in the aftermath of that, the dogs never ventured to the other side. They associated the other side of the cage with getting punishment. They knew that when they crossed a certain point, they would receive a shock. And as a result, they stopped even trying to get to the other side. But what's critical here is the machine had been turned off. They could have, had they given another chance, gone to the other side of the cage. But because they associated the other side of the cage with the receiving of a punishment, they decided, you know what? What's the point? Punishment is inescapable. If I go over there, I'm going to get shocked again. And they stopped even trying. And the key here, again, is success could have been obtained. The machine was turned off. The same way that if you tried a little bit harder or perhaps approach studying a little bit differently, you could be successful on your next math exam. That phenomenon is called learned helplessness. And the reason this relates to operant conditioning is that punishment, in theory, as we talked about, is going to make a behavior stop. If you tried in your math class and failed, you're going to stop trying because your attempt at doing well resulted in a punishment, a failing grade. The dogs are going to stop trying going to the other side of the cage because every attempt that they made, at least originally, they were shocked. They received a punishment. Well, according to operant conditioning theory, you're going to stop the behavior that led to the punishment. So the animals are going to stop going to the other side of the cage. Again, even if those machines are turned off. The next phenomenon is called superstition. This is a term that it's very likely a term that you've used before in some context. Superstition is when an organism repeats a behavior because it was accidentally, randomly paired with a reward or a reinforcement. Meaning, let's say you happen to wear a green pair of socks to a soccer game and you just happen to score 3 goals, the best game in your high school career. And then you tell yourself, wow, it must be because of these lucky socks. Well, those socks didn't have much of an effect on your performance. It's totally random that you just happen to be wearing those green socks. However, the behavior of wearing green socks just so happened to accidentally, randomly be associated with the reward or reinforcement of scoring 3 goals. And according to operant conditioning theory, if a behavior ends with a reward or a reinforcement, you're going to keep doing that behavior. If those green socks happen to be the ones that you wore when you scored 3 goals, you're going to continue repeating that behavior because the previous time that you wore those green socks, the consequence was desirable. Of course, scoring 3 goals. This is the very simple explanation for how superstitions form. Organisms very frequently, though totally accidentally and randomly, associate one behavior with a reward when the two are actually unrelated. And that's really the key here. Wearing green socks and scoring 3 goals is unrelated. There's not a cause and effect relationship between those two. But nevertheless, an organism might form a superstition because of the accidental pairing of a reinforcement with a totally unrelated behavior. The last one is a little unusual in the sense that you might never have seen this, at least no real life applications of this. So I totally concede if this sounds a little unusual, but I'll try to give a good enough example. Biofeedback is a medical technique that's often used to help patients who might experience something like anxiety, perhaps in social situations. And it's literally a device. It's a biofeedback machine. And it's a very portable, small little device, no bigger than maybe a cell phone. And what it does is it in real time tells the patient or the person wearing it their body vitals. So their heart rate, their breathing rate. It gives a good real life, in the moment update on their bodily functioning. And what it will do is if it detects that your heart rate has been increasing or your breathing rate is increasing, it will alert you. It will give you the indication that your body is undergoing the physiological changes that would be associated with anxiety. The point of doing that is hopefully these patients have been trained, maybe by a doctor or a therapist, some relaxation techniques, perhaps some breathing techniques, most often cited, that are designed to reverse the physiological changes that go along with anxiety. That way, when the person is alerted in class, at work, in the supermarket, that their body is beginning the response that would match up with anxiety, that they can, in real time, start their relaxation technique. And the reason that's so useful is once you start these relaxation techniques, if they are in fact going to work, what you will see in real time is that your anxiety level begins to drop. Your anxiousness begins to drop, and you'll be able to see that. Your heart rate goes down, your breathing rate goes down. And then this machine, in real time, tells you your relaxation technique, your meditation is working. If you are told that your meditation technique is working and you've been trying to deal with anxiety, that is very rewarding to the person. That works as reinforcement. And what it does is it essentially trains the patient to always rely on the relaxation techniques that they have been shown to be effective. And that the next time they experience anxiety, even if honestly they're not even necessarily wearing the machine, they can start to implement these relaxation techniques because they've been rewarded in the past for using these relaxation techniques. And the reward has been just knowing in real time that it's working. Your machine is telling you this meditation is working. That in and of itself works as a reward so that the next time the person experiences anxiety, they utilize the same behavior that alleviated the anxiety the previous time.